Avian influenza, or bird flu, is a virus that primarily affects birds. This virus can cause mild to severe illness in birds. Sometimes, bird flu can spread to humans, especially those in close contact with infected birds. While human infections are rare, they are a serious public health concern. In recent years, a particular strain of avian influenza, H5N1, has caused widespread outbreaks in birds worldwide. This strain has also been responsible for a growing number of human cases, raising concerns about a potential pandemic. The situation requires close monitoring and proactive measures to prevent the further spread of the virus. Understanding the risks and taking necessary precautions are crucial for protecting both human and animal health. The potential for bird flu to mutate and spread more easily between humans is a significant worry. Scientists and health officials are diligently tracking the virus's evolution and working on developing effective vaccines and treatments. The United States is experiencing its worst outbreak of avian influenza to date. As of January 14, 2025, over 134 million poultry birds have been affected, leading to significant losses for the poultry industry. The virus has also been detected in dairy cows, with 925 herds affected across 16 states. Human cases are also on the rise, with 67 confirmed and 8 probable cases reported. California leads with the highest number of human infections, followed by Washington and Colorado. Tragically, 1 death has been reported in Louisiana. These numbers highlight the seriousness of the situation. It's important to note that the actual number of cases, both in animals and humans, may be higher due to limitations in surveillance and reporting. The widespread presence of the virus in wild birds further complicates the situation. With migratory patterns, the virus can easily spread across large distances, making containment efforts challenging. The avian influenza outbreak has had a devastating impact on the poultry and dairy industries. The culling of millions of birds to control the spread of the virus has resulted in significant economic losses for farmers and businesses. This, in turn, affects the supply chain, leading to potential price increases for consumers. The Centers for Disease Control and Prevention, or CDC, is actively monitoring the situation and working closely with state and local health departments to control the outbreak. The CDC has enhanced surveillance efforts to track the virus's spread in both animals and humans. They are also collaborating with international partners to share information and coordinate response efforts. Research is ongoing to better understand the virus and develop effective vaccines and treatments. The CDC emphasizes the importance of biosecurity measures on farms to prevent the introduction and spread of the virus. This includes restricting access to poultry and dairy facilities, implementing strict hygiene protocols, and promptly reporting any suspected cases. While the risk to the general public remains low, it's crucial for everyone to take precautions to protect themselves and their communities. Avoid direct contact with wild birds, especially sick or dead ones. If you find a dead bird, report it to your local health authorities. Practice good hygiene by washing your hands frequently with soap and water, especially after handling poultry or eggs. Cook poultry thoroughly to an internal temperature of 165 degrees Fahrenheit to kill any potential virus. If you work in close contact with poultry or dairy cattle, take extra precautions, including wearing appropriate personal protective equipment. Stay informed about the latest developments and follow the guidance of health officials. By working together and taking necessary precautions, we can help limit the spread of avian influenza and protect both human and animal health. Remember, prevention is key in the fight against infectious diseases.